Science and Cybersecurity webinar. Give it just one more minute to get a few more people here, and then we'll go ahead and get started. In the meantime, thank you everyone who came. We appreciate you guys taking the time for this. We hope that it will be educational and a good use of your time. My name is James Fair. I'm one of the VPs here at Executech, and with me is the esteemed Adam Austin. Hi, Adam.
Hi.
So, are we ready to go? Should we go ahead and get started? Yeah, all right. I think we're good. We'll go ahead and start. So, as I said, my name is James. Welcome, everyone. We're going to talk today a bit about HIPAA, a bit about cybersecurity, what we can do to help you folks, what these guys can do to help you folks, what HIPAA really is, what high tech rather, sorry. And I'll let Adam speak to this a bit more. As I understand it, HIPAA is a series of rules and regulations around patient data, private information, and high tech is the enforcement of those rules with some breach notification added. And I'm sure Adam can speak to this far better than I can. We're going to leave some time at the end. So if you have any questions, by all means, please type them in the chat, and we'll hit those at the Q&A part at the end there. So let's go ahead and roll the slides if we could, please. I'll turn myself off here. All right. So as we mentioned, it's an overview of cybersecurity in the healthcare space. So to start with, one of the easiest things you can do, we tout this all day and night, please, please, please turn on multi-factor authentication. It is not flawless, but it is far better than anything we have right now, that's reasonably achievable and within a cost effectiveness. It's just one more factor, right? My phone's going to text me, it's going to shoot me an email, it's going to send me a text code, something, so I have an additional piece of information before I log in So it's not just login and password. There have been SIM card hacks, and we can talk about that a little bit later, but really this is probably your easiest win for creating some additional security in your environment. Quick and easy win, okay? All right, so first I want to talk about what the bad guys see, right? So we all have these networks. Inside of our network, we have all these computers and people and machines and various things, but from the outside, what do the hackers see? So if you have not done so, I strongly encourage you, in fact, I think it's a requirement, which Adam will talk about here, to have an external test done. What does it look like from the outside? So we all have these modems or hopefully these firewalls in place, and those are what the hackers see. So the folks that are outside on the internet, they're going to hit your firewall or hit your modem, and they're going to scan that thing, and they're going to find out what's available, what's open, what's not, and that is the perspective you should have. If you don't know what's available on the outside, what that looks like, you should. What's my posture on the outside? How do I appear to hackers? Because the idea is we want to close all those gaps as much as possible so that we do not appear to be open whatsoever on the outside. There we go. And then inside, which employees have access to what data? So over half the breaches come from internal. So what are we doing about those? And this can be simply like someone got access to the HR data that they shouldn't have. So how often are you checking those permissions? Do you audit them at all? And if not, I would certainly recommend you do so. It's because half of these breaches come from internal, it's super important that we have not only audits done, but ways to track those things. Is there some way to know if someone got in the HR data? Would you know about that? Oh, let's go to the next slide. That's a silly one, sorry. All right, and then we'll talk about next-gen firewalls for a sec. So I don't know which brand you want to use, but please, 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 if you do not, get a firewall. Have a next-gen firewall in place. As I mentioned, this is what's preventing the hackers from getting in. This is the gateway between you and the rest of the world, between your network and all your private data and the rest of the world. So this is where you want to put a little bit of money. This is where you want to spend some time. This is where you want to make sure that this thing is set up correctly. There are things that we can do in here, such as intrusion prevention. So if someone in a foreign country is attempting to hack into my firewall, does my firewall know that's happening? And if it does it automatically block it? And then things like dynamic blacklisting. Is there a real-time list being created by a cybersecurity group? And then I get that list periodically so that I know how to automatically block those things. That's your dynamic blacklisting. Content filtering. Are we filtering against adult sites? Are we blocking things like hate sites? Now we can get very specific in these next-gen firewalls. We can say we want the category of guns to be allowed, but not hate crimes to be allowed. So content filtering is super important. Keep your employees going where they should be going and not where they should not be. And then it will also do any kind of antivirus or anti-botnet. So it's going to, every packet that goes in or out of that network, it's going to take it apart, look inside, and see, is there a virus in here? Is there some kind of malware in here? And if so, it's going to block that from happening. All right, Cloudflare does not pay me to say this, but if you run a website, I would strongly encourage you to get Cloudflare. It's very inexpensive, and these guys have really kind of revolutionized the way that websites are presented. It's not very expensive, as I mentioned, and they will duplicate your data all over the world on different servers all over the world. And they have a way of preventing dynamic denial of service attacks. So we've actually had clients in the past who have gotten denial of service attacks, right? Some guy launches 2,000 computers attacking them at the same time, and then calls them up and says, all right, if you want this to stop, pay me. Well, Cloudflare has a really quick and easy way to prevent this from happening instantly. So if you're on Cloudflare, denial of service is no longer an issue moving forward. InterceptX. So there may be other products that do this. I'm not familiar with any. Sophos is a company that came out with this product called InterceptX, and it's an anti-ransomware tool. So rather than a traditional signature-based solution for antivirus. So I've got my antivirus program. I download a program. It's a bad program. My antivirus knows that. It sends that signature of that bad executable out to everybody in the world that uses the same antivirus I do. Now we all have those lists, and we're sharing these lists. But it's a very reactive approach. So we have to wait until that thing is out there in the world before we know to block it, and we send that signature to everybody. InterceptX is a behavioral-based model, so they've changed the thing a little bit here. So instead of reacting to signatures, we're going to look at behaviors. So, okay, one file is being encrypted. That could be normal. Now it's 10 files. Well, it still might be normal. Now we're up to 30 or 40 files. All right, let's prevent whatever is causing those files to be encrypted. So it doesn't necessarily clean anything, but it watches for bad behavior, such as encrypting files. And we know that ransomware does that, and it stops it cold. Then we can come in and we can figure out what's going on. We can clean it off and do the things that are appropriate. So highly recommend it. It's not very expensive. It's like $250 a month per end device. Super, super effective. I strongly encourage you folks to look at this as a possible option. All right, we're talking about email, because email is really kind of the attack vector these days. We do see, attack vectors come in all forms. We still want to put our firewall in place and our antivirus in place and do all these things that we want to do to prevent attacks. However, attackers are also knowing and realizing that the busy employee, that's the person to go after, the person who is locked down and can't get time to do anything else. So email is a really big attack vector. So we got some things like encryption. If you send private information out, and I can talk this a little bit more, I'm sure, but if you're sending any kind of private information or patient information in email, while it may be encrypted from you to your email server, from there it's not. So get an encryption of some kind. 365 offers it. There's lots of options out there. Get some kind of email encryption so that you know end to end that data is never going to be viewed by anybody else. Get a spam filter. I've seen customers come in and we layer on a spam filter, and as high as 60% of their email could be spam. So not only are we cutting out all that, 60% of the email they get is suddenly not have to be viewed anymore. So we're increasing the efficiency almost immediately of those employees. And a lot of stuff can't, those are clicking options, right? Someone could click on the wrong thing. So let's prevent that from happening. And then geo filtering. If you're doing business with other countries and you do not need to be, then, excuse me, let me take that back, sorry. If you are not doing business with other countries, then consider blocking those countries. You can see by the map there, different shades. The darker it is, the more malware we've seen come from those countries. This isn't my map, I didn't make this up, but it's a Microsoft from 2017, I believe, or 2018. So these filters are pretty simple to use. We can say, I want to block anything from, I'm not going to name countries because I'm not going to name names here, but it's pretty easy to do. Turn on geo filtering. If you're not doing business with Asia, then why allow traffic from Asia? Why not cut those people immediately out, and any potential hackers that may be there immediately stopped? And then data loss prevention. So data loss prevention is the ability to search email or watch for email that has certain patterns. For instance, if it's a credit card pattern, I know the 444 code, I'll look for that. Or social security number, I'll look for 343 or 4, whatever it is. If those are going on, do you know it? Do you know what's happening? Did you block those from going on? Because you can. With data loss prevention, you can layer this on and you can have it either block it, you can have it sent to somebody else for reviewing before it goes out, or you can have it automatically encrypted. Lots of options of data loss prevention. And then I want to talk about backups. So this is super, super critical. I don't care where you get them. Please, please, please have cloud-based backups. We've had too many conversations with customers who come to us and say, we got ransomware. What should we do? And I say, do you have backups? And they say, we don't. And I say, well, how bad do you want your data back? Because unfortunately, there's really uncomfortable conversations. Please, please, please. Backups will save you from theft. It will save you from fire. It will save you from flood. It will save you from ransomware. Whatever it is, please create backups. Use cloud-based ones that are away from your business, and then make sure they're separate credentials. We've also seen ransomware try to use the same credentials to hack into our backups as well. And then consider, although there's some significant cost to it, if uptime is critical for you, consider some kind of a disaster recovery solution. I'm going to list two that we're familiar with. It's Microsoft Azure and Acronis. Both of these offer server solutions where if your server goes down because of fire, flood, power, internet, whatever it may be, then those servers on the cloud automatically get spun up and your employees can connect to those and continue to work. Okay, we're talking about HIPAA here for a bit, so I'm going to turn over the time to Adam and let him take it from here. Adam, all you, man.
Yeah, perfect. Thanks. Thanks, James. I'm Adam, the cybersecurity lead for Totem.tech, and we are super excited to be partnering with Executech for this HIPAA and high-tech webinar. So I'm going to talk about the compliance aspects, and James just went through a slew of what we call safeguards, aka controls, aka best practices. So he mentioned a dozen or so best practices, but how do you know what you really need to implement to be compliant with these regulations? So we're going to talk about HIPAA, the Health Insurance Portability and Accountability Act, passed in 1996, which was at the beginning of the internet. So there was a concern that started with the electronic use of certain type of healthcare information. And then in 2010, the Department of Redundancy Department passed the HITECH Act, which is the Health Information Technology for Clinical Health Act, which expanded and updated HIPAA. And they both are federal government requirements, which actually take precedent over any state requirement to protect certain health-related information for both public and private organizations. So next slide, please. The type of information that they are geared at protecting is something called protected health information. So it's health-related, health care, or health condition-related information that can be definitively associated with an individual. So there are elements of information about an individual, such as name, social security number, biometrics like fingerprints or dental x-rays, birth date, address, that these are individual standalone elements that can identify an individual. And if they're associated with healthcare information, then that is now deemed PHI, protected health information. But there's also the concept of aggregation of information. So if we have a piece of health-related information that identifies the adult male living at 1026 Riverbend Lane in Ogden, Utah, well, there's only one adult male that lives at that address. That's myself. And so that can be used to positively identify me and associate my healthcare information with that. So what we're looking to do here is protect the privacy of individuals and secure their health-related data. By the way, most of the information in these slides is publicly available, and you'll see several different links, particularly to Department of Health and Human Services, that's HHS websites. And then towards the end, we'll get into some National Institutes of Standards and Technology, NIST, links as well. Next slide, please. So we talked about these laws are geared at protecting PHI. There's a way to de-identify PHI, two different ways actually. You can employ a qualified statistician to determine that aggregate data does not constitute PHI, since most of your private HIPAA compliant organizations don't employ a qualified statistician. You're probably looking at the option number 2, which is to completely anonymize the data. So remove any identifiable elements from that data set. So for example, let's say you're a cancer treatment center and you want to share some of your health related information with a cancer research center. You have 2 options. You can you can send PHI or you can send de-anonymized PHI. If you're going to send PHI, you better make sure you have permission from the individual to send it. And like James mentioned, you better make sure that you encrypt that data both in storage and transmission. Secondarily, you could de-identify the information, which is have a documented process to strip all identifiable data elements from that shared data. Next slide. So this is the information that these 2 laws are requiring us to protect. Who is responsible to protect this? Well, the HIPAA and HITECH identify what they call covered entities, which means they are required to abide by these laws. And we have here a table of 3 different types of covered entities. Your healthcare providers, so doctors, dentists, chiropractors are on here, nursing homes, pharmacies. Health plans, so your HMOs, your health insurance companies, they're covered entities. But so are healthcare clearinghouses. And these are third parties that might receive data from one of the other 2 covered entities. These are your things like your patient portals. So every time we go to the doctor or dentist now, you have to fill out your HIPAA related, your health information through some cloud-based service, right? Those are considered clearinghouses and they have to abide by these same regulations. The other type of organization that's covered under HIPAA is the business associate. And these are, again, third parties that would potentially come in contact with PHI. So the second bullet down, you see a CPA firm who provides some sort of accounting services to a healthcare provider, but in doing so, they have to do IT audits or something like that. They could potentially come in contact with PHI. Then they need to, their own organization has to be compliant with these rules and regulations. And then second from the bottom, independent medical transcriptionist. So every time I go to my primary care physician now, there is a third person in the room clicking away on a keyboard, essentially jotting all of our interactions down there, transcribing the whole interaction. That organization that employs that transcriptionist has to abide by HIPAA and HITECH as well. So what are they asking us to do? What's HIPAA and HITECH asking us to do as a covered entity? 2 things. Provide adequate security to protect confidentiality, integrity, and availability of PHI. And all of those safeguards that James mentioned in his intro were geared towards protecting one of those things. It's the holy triad of cybersecurity, CIA. So there's the security rule, and there's also the privacy rule. So this is protecting the privacy of the individuals who have this information, this healthcare information related to them. And the privacy rule essentially says don't over collect, so only collect information that you absolutely need to provide the service. Don't overshare, so if that information has to be shared, only share it with third parties that absolutely need it to perform whatever service they're performing. And then have a documented process to notify individuals of breaches. And in this day and age, breaches, we should operate under the assumption that a breach is inevitable, and you need to be prepared to respond to incidents, as James mentioned, as well as known disclosures of information, which is what we call a breach. Now, there are no official government sanctioned HIPAA compliance certifications for organizations. There are sanctioned certifications for individuals. So your information security officer or your privacy officer at your organization can get an individual certification. But for the private sector, there's no sanctioned certification or compliance process, really. Both HIPAA and HITECH call out the Department of Health and Human Services and its sub-agency, the Centers for Medicare and Medicaid Systems, CMS, to conduct periodic audits. But if you look at the HHS website, they're only conducting a few dozen audits a year. And so they're going to target the heavy hitters, your major healthcare organizations, health insurance providers, your large hospitals. So the chances that you as a small private covered entity get audited directly are low. You may be caught up in an audit if you're associated with a hospital or something like that. So there's really little chance that as a small business you're audited, and then there's, like I said, no official compliance mechanism, but there is a penalty mechanism, and you see here on the table on this slide four different violation categories. So the Health and Human Services Department can actually penalize covered entities if, say, they didn't know that they weren't in compliance with the security or privacy rule. Then there's up to from a minimum of $100 up to $50,000 with a maximum annual fee structure of $1.5 million. And then there's reasonable cause. So their definition of reasonable cause is that there's some circumstances that make it unreasonable for your organization to comply despite the fact that you've exercised due care. And then there's willful neglect, which is conscious, intentional failure to comply with either the security or privacy rule. But our goal here is not to get any penalties, right? So let's set ourselves up for success and compliance despite the fact of no official compliance mechanism. How do we do that? We comply and we assert our compliance through a risk management process. So you see here we have two cycles listed on this slide. The interior cycle is something called the Cybersecurity Framework that's developed by NIST, the federal government. It requires basic steps to identify breaches and protect against those breaches. But I want to focus on the outside cycle here, which is something called the Risk Management Framework that's developed by the U.S. government. And these are it's a general construct to ensure an organization provides that adequate security and privacy for any types of information, and it works for PHI as well. So working from the top and going clockwise, we have 5 high-level steps. Select safeguards or best practices or what we call controls, and I'll use those words interchangeably here. Select the set of controls that works best for your organization. Then implement those safeguards. Then have some sort of assessment, preferably third-party assessment, that you've chosen the appropriate safeguards, so validation, and that you've implemented them successfully, verification. And then some executive within the organization blesses off on the systems and processes and people that are going to process PHI. So the system is authorized to collect, store, transmit PHI. And then over time, we monitor those safeguards for effectiveness. And if they become ineffective, so if we know we had a breach or we got popped by an adversary, compromised information, then we need to adjust fire, right? We need to adjust the safeguards that we have in place because we are now at more risk. So what safeguards should we select as a private sector covered entity? Well, for the public sector, there's a list of safeguards that are developed and published by CMS, that's the Centers for Medicaid and Medicare Systems. And they call them the acceptable risk safeguards. It's a list of several hundred individual best practices that are expected of public sector IT systems and organizations that process PHI. But for most of you all on this webinar, this is going to be overkill, and it's directed specifically at the federal government. And you can see wording. I have a couple of little banners there on the right side. There's a lot of wording in the ARS that's government specific. So you can see they're calling out CMS and HHS, and then SORN is another acronym, that's System of Records Notice. So you actually have to publish the fact that your IT system operates in the Federal Register. It's overkill for us. Luckily, there's a better option. NIST has put out through what they call Special Publication, SP 800-171. So their 800 series are all of the cybersecurity guidance that NIST publishes. And our federal government puts out the best cybersecurity guidance of any organization in the world. And it all comes through NIST, through this 800 series of documents. The 800-171 is geared toward non-federal, so private sector organizations. In fact, the title of it is Protecting Controlled Unclassified Information in Non-Federal Systems and Organizations. And Controlled Unclassified Information, the acronym is CUI. In this guidance, in this standard, they actually say that PII, which is personally identifiable information, of which PHI is a subset, can be considered CUI. So let's use this as our set of best practices that we can implement as a private sector covered entity. There are 14 groups, families of related controls that encompass 110 overall requirements, and then 320 individual actions that the organization actually has to take. The NIST calls them assessment objectives. We call them organizational actions. Each one of those best practices that James mentioned in the intro fits into one of these families or meets one of these 110 requirements, 110 controls. But there are others. And it's actually about 50-50 in 800-171, the types of controls that you meet or that you implement through developing policy or writing documents. And then about 50% are implemented through some sort of technological or procedure within the organization. So let's look at a couple examples in the next slide. And I'm not going to dig too far into the weeds with what's in 800-171. I just want to give you a couple examples. Access control family, there's a requirement to limit unsuccessful logon attempts. So our adversaries or an external or even an internal threat is going to try to what we call brute force password attempts. So try to guess your password to log onto the system. If you limit unsuccessful logon attempts, you can help thwart that activity. In the same family is a requirement for multi-factor authentication, which was James's number one mitigation you can put in place, and the first thing that any organization should be looking at putting in place. It's another requirement in the access control family. You can see personnel security. There's requirements to screen individuals. This is kind of a no-brainer, especially for folks that you're going to allow access to your sensitive information like PHI. And then security assessment family at the bottom requires the development of something we call a system security plan, which are like the blueprints for your cybersecurity program within an organization. So it's a set of policies that dictate how the organization is going to handle cybersecurity. And then to have that, there's also a requirement to have that system security plan assessed periodically. So that's the 800-171 controls themselves are going to help us meet the security rule. For the privacy rule, we at Totem.tech have developed a custom privacy control family. We actually distilled all of the privacy related controls out of the CMS ARS, which I mentioned earlier, we condensed it way down and got rid of any mention of public or federal government requirements. So there are 11 controls in this family with 61 actions that the organization has to take, such as, you can see 3 here listed. Identify the purpose for the collection of PHI that the organization collects. So have a written document that identifies why you're collecting the information, and then publish that to the public. So you'll see every website now has a privacy notice on it. It's just dictating that you have a privacy notice. And then there's a requirement to appoint an official within the organization that's in charge of the privacy program. And then to conduct a privacy impact assessments periodically and whenever the operational environment of the organization changes, assess what the impact that change would cause to the individuals whose information you collect. So the combination of the 800-171 to meet the security rule and our custom privacy control set to meet the privacy rule will put you well on your way to compliance with HIPAA and HITECH, and also is a great foundation for those of you that have to work with European entities. Europe has its general data protection rule now that requires all sorts of privacy protections for any type of information for European citizens, not just health information. And then California recently passed its Privacy Protection Act, and other states are following suit, including Utah. So implementing 800-171 and then implementing a privacy program is a great foundation to help you meet any sort of privacy protection framework that's out there. So that's a little bit about what it takes to be compliant. A lot of you are going to be asking, well, where do I start? Like, what's my first step? If you haven't done so yet, so use those controls, the 800-171, and you can talk to us about our privacy control set, and start developing your system security plan and a privacy plan. So start writing down your policies that will help you meet those controls. Don't start necessarily with a bottom-up approach and just start buying technology to solve these problems. Start from a top-down approach so that you can use your money effectively and buy the appropriate technology for your particular organization. If you've already started on that process, or as a second step, you're going to want to have a third-party assessment, risk and security assessment performed. The penetration test that James advocated would be part of a security or risk assessment program. And it's best practice to have a third party perform those types of assessments. Not necessarily required, but it's definitely a best practice. So yeah, that's really my time. This is some contact information for us at Totem Tech. And we're always happy to chat about any of this stuff, try to clarify some things. I tried to put URLs in this presentation, and I believe it'll be made available afterwards. So you can go hunt down and do some searching on your own. So yeah, thanks, James. I'll turn it back to you.
Excellent. Thank you so much, Adam. So in case you guys couldn't tell, Adam is definitely the expert here. Adam's a certified information security manager and a certified information systems auditor, and obviously knows this stuff really well here. So just wanted to touch on a couple other things. So some of the things that he mentioned, access controls, and he was referring to electronic access control. There's also physical access control. So who has access to your server room and your servers and your switches. As I recall, it's a requirement as well. Now you can do a more expensive solution. We certainly, would never discourage anyone from doing a full access control system. It is expensive, and as I understand it, you can qualify with a clipboard and a pen and some notes that say log all your time going in and out of there and hide the key somewhere. So plenty of options, access control, and Executech can help with an access control solution if you need it. And then configuration management. This is another one that he mentioned. Do you know what's being changed in your systems? Executech is going to offer here very shortly a configuration system tracking. So historically, we can go back and look and say, oh, hey, this user logged into a computer they don't normally log into. That should send up a red flag. So I would certainly consider that one. And then security assessments, as he mentioned. Now, we are not an official certifier, but we certainly, ours is probably far less expensive than most. So if you do want a security assessment, we can do an external, or we can come in and do a free internal assessment as well. That does not qualify you for the HIPAA compliance regulations. That's a third-party official one, but it gets you some information, right? Where do I start? Where's the low-hanging fruit? What can we take on easily? And talk a little bit about social engineering. That is, as I mentioned before, hackers are going after the people. The employees are the easy target, or the easier targets. They're busy. They're working 10 plus hours a day. They're looking at 10,000 email messages. So, and I'm going to tell you a story I had. So I was the IT manager at a previous company, and my office was at the far end of the building. And I saw some motion, and I looked up, and a guy was walking past me, and he was taking pictures. I heard just click, 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 and he's taking pictures as he walks past my office. And I thought, I don't know who this person is. So I stood up to talk to him and said, can I help you? And he bolted, he ran. I mean, he just took off out of the building. And I thought, wow, I'm clear at one end of the building. I wonder where he went. So I walked back through the building, through the developers area, through the software guys, around accounting, downstairs to the receptionist, and said, hey, did you see a guy taking pictures? And she said, yeah, he came in and said he needed to take pictures, and away he went. So one of the things I recommend for social engineering is just ask. We don't have to be rude about it, but if there's someone in your environment you don't know, take the time to ask them. It's not a confrontation. It's just, hey, can I help you with something? Is there anything else that you need from us? And then watch for Facebook. People are going to try to get your private information in order to phish you, in order to attack you, particularly if you're a high-level person in your organization. So I put up an example here of a Facebook request that I got. Now you notice the first one, he had 2 mutual friends, but he had a lot of things in common, a lot of hobbies and things that I do. So I'm going to be very likely to click on that person and accept him just because we have common things, we have hobbies in common. But he may be simply phishing for my private information in order to figure out my multi-factor authentication or my password or birth date to do a password reset. The last one you can see on there has 14 mutual friends, and yet I didn't know that person. I looked and he had made all friends with all my friends, but I did not know that person, so I did not accept it. Now, a lot of us, it's habitual, like, oh, they're friends with my friends. We're probably on the same page. Just exercise caution, exercise some healthy paranoia, let's call it. There are different types of phishing. So phishing and spear phishing. Spear phishing is when you go after a certain target, like a CEO. There's vishing. There's a whale attack. Whale attack actually is a thing. That's when you go after an individual target. The big players in the market, the CFOs, the people who are making the big bucks. Baiting. So if I went to your organization and I threw a bunch of flash drives out around your parking lot, how many of your employees would pick those up? If it said something cool on there, or something said something free on there, would they pick those up and plug them into their work computers? And do you have a way to deal with that if so? And then pretending to be IT. This is a pretty common attack method. If I call you up and say, hey, I'm the IT guy, will you please go to this website? Chances are you're probably going to do it because I told you I was IT. If you're not familiar with your IT staff, you should be. Figure out a code word, figure out something, and pay attention to those things because people can fake it pretty easily. And then look out for social interactions. So anything where people are asserting authority, or if they're coming to develop rapport and trust with you out of the blue, using human attraction, right? That's been a thing for thousands and thousands of years. If suddenly someone decides to approach you and it's not someone who's normally in your social circle, just again, apply some healthy paranoia. And this is a thing where people tend to get a little looser about their information when they're intoxicated. So maybe it's time to have a hard conversation with some more employees to say, hey, if you're going to go do that, be aware, you should never disclose any work information. Let's go ahead and skip this. I'm going to skip. We don't have time for a video. So hit it twice if you would. It's going to skip over it. Sorry. Okay. So a couple things you heard from my presentation. The most common attack vectors we're seeing nowadays are email and people. So again, I'm going to encourage you to leverage those things that stop those. For instance, train your users, right? We spend all this money on firewalls, on antivirus, on these things, and yet we're not training the end users. So I'm going to really encourage you folks. These are the gateways. Just like in that example I gave you earlier about the picture taker, no one was trained on approaching someone or asking them questions about that. Layer on a great spam protections. I mentioned earlier in the slides, block all that spam, block those things that people don't have a tendency to train on. Train your users. And then take a different approach, right? And I hate to be this way, but the truth is every interaction online should be suspicious. Even if my wife sent me something, I'm going to check. Maybe I'll call her and say, hey, is this link real? Because this does not look like something you'd sent me. Or she sent it to me at 2 a.m. and I know she was in bed at that time. So again, just be aware, be conscious, be conscientious. So again, I want to mention train the users, right? They're the gatekeepers for all this. And then tailgating is a pretty common thing nowadays too, especially if you have access control. If someone with a big heavy box suddenly walks up right at the same time you do, and they can't seem, they're fumbling with their card, they can't seem to get it out, same time they're holding this box, and you go, oh, let me get that for you. Be aware, that may not be an employee. That may be somebody set up to try to get into that, get through there. Also, watch for people come behind you. If you swipe your badge card and someone's right up against you as you go through, that's tailgating. Again, they're trying to get past the access control. And we mentioned the bar thing. Again, just be very conscientious. If you suddenly, a stranger walks up to you at a bar and starts asking you questions, think about it. What's going on? All right, next slide, please. There we go. So, as much as I don't want to do it, it's probably time to compartmentalize information. Does everyone need to know everything? Is there a need to know basis? Sometimes your IT people, yeah, they need to know most everything, but not everything. Let's go ahead and skip the next one if you don't mind. So have a BYOD solution. Everybody these days are bringing their phones, they're bringing their tablets, they're bringing laptops, they're bringing everything to work. And if you give out the wireless password, I guarantee those personal devices are jumping on your wireless so they can listen to streaming music, whatever it is they do with those phones. So have a BYOD solution. That's a bring your own device. Have a bring your own device solution where people can get on a guest network and they can put their personal devices on the guest network and it's not on your internal network, separating them very clearly. So allow your IT department to say no. This is something, I'm an IT guy, so I'm going to encourage this. There have been times in my career, and I'm sure others, where someone, a decision maker, will say, no, we need to do this. And even though the IT person probably felt it was in their best interest not to do that, it might create a hole or a breach potential or an attack vector. So take the time to listen to your IT folks. If they're telling you no, there may be reasons for it. Now, it could be they're just negative people, hopefully not. But if someone's saying no to you for a request to open a firewall port, to do something remote access, take the time to understand what is the impact, what is the risk associated with that. And then listen to yourself, right? If it feels wrong, it probably is. We pick up, there's like 70% of our communication is nonverbal. So there may be things that you pick up that you don't know consciously. So listen to that internal self. If something comes up and says, something's up here, pay attention to that feeling. Be on the lookout for, I just need. If someone comes to you and says, I just need this done, I just need that, that's a big red flag in our world. In the cybersecurity world, I just need is typically someone trying to push an agenda that isn't what they actually want. And then have guests wear guest badges. If someone walks in a facility and you don't know them, they should be wearing a guest badge so that you know that who they are and why they're there. And then again, train everybody. If they're not wearing a badge, ask them, why are you here? Can I help you? What do you need? Is that it? Oh, sorry. Thank you. And then I'd like to change it. So a lot of us come from a position of, how do I prevent this from happening? How do I prevent this from happening? What do we put in place to prevent this from happening? And that's a great posture, don't get me wrong. But an even better one would be, what do we do when we get infected? Just in case, right? I hope it never happens to anyone on this webinar. But if it does, how do you react to it? There's a lot of potential damage that can happen between the time you realize you're being breached and the time you can successfully do something about it. So have that mindset in place. Let's focus on prevention. That's great. But what do we do if we're already infected so that you're prepared in case that does happen? Okay. Q&A. So again, I don't have any questions at the moment, but if anyone has any, please feel free to type it in the chat, and either Adam or myself would be happy to respond to any of those. Give everybody just a minute here to see if anybody has any questions.
Yeah, I'll add on to one of your last
please.
statements there. That coming from the perspective of not just preventative medicine, but healing. So what happens when we are infected? That's actually required by the privacy rule, that you have a documented process to correct the inevitable breach of information. So you have to operate under that mindset to be compliant with HIPAA and HITECH.
Excellent. Okay, any questions coming in? Can we help anybody with anything? You see a pretty good presentation. Thank you, Adam.
Yeah, thanks, James.
All right, we got a question here. If your computer is hijacked for ransomware, what is the first step? I'm going to take this? You want to take that?
Yeah, the first step is pretty logical, right? So identify the computers that are compromised with the ransomware and disconnect them from the network so the ransomware does not spread, in case it's what we call a worm. Don't necessarily turn them off, just unplug them from the network. You may need them on to help diagnose the true cause, the true vector of the infection. So first step, number one, is disconnect them from the network to stop the spread. Yep.
Yeah, no, that's the first solution we always recommend. Stop it from happening, and don't clean it off unless you're certain you have backups and can do something. Cleaning it off can also remove the ability to unencrypt those files if there does have to be a ransom paid. So, yeah, we all do it. Or believe me, we all have nightmares about ransomware. we don't sleep well because of it.
Yeah.
So Ted had a question. Ted's question is, what is involved in a security assessment?
I can.
Please, all you, Adam.
So there are, at the risk of getting pedantic, there are 4 different types of assessments that are associated with cybersecurity. You have a controls assessment or safeguards assessment, and I mentioned that during the presentation. That's validation that you have the correct controls selected and verification that they are implemented properly. That's what we call a security controls assessment. You have at a higher level, a risk assessment, where you analyze 3 factors of risk, which are what threats are out there arrayed against the organization, what things of value, or what are our assets within the organization. So what if that asset was compromised, how much value would we lose? Would we lose reputation? Would we have to spend $1 million on identity protection because we got PII breached? So what are the threats? What are your assets that could be compromised? And where are your vulnerabilities, that the weaknesses in your organization that those threat actors could exploit? But in order to understand vulnerabilities, that leads us to our third type of assessment, which is a vulnerability assessment. So what are your operational, procedural, technical weaknesses within your environment? So that's the third type of assessment. And then to really test which of those are real, which of those vulnerabilities are real and which are exploitable, is the penetration test, which James mentioned. You can really attack those 4 different types of assessments in any order, but realistically, you would want to start with a risk assessment just at a very high level to see, so that you understand what things of value you need to protect in your organization.
Cool. Okay. Adam, thank you very much. Everyone for attending, thank you very much for your time. Hopefully this was educational. And if you have any questions, by all means, reach out to Adam, Executech, Adam at Totem Tech, or James Fair at Executech. We'd be happy to get you taken care of. So thank you, Joanne. We appreciate it. Thank you all for attending. There will be a recording later, as mentioned in the chat. And everyone have a fantastic day. Thank you so much.
Thanks, y'all.
Take care, guys.